Good evening, everyone. How are we all doing? Wonderful nurses and midwives. How are we all doing? Please notify me in the comment sections. All right? If you can hear me, notify me. So today we are going to discuss an important topic, and I want you all to write. That is why we are using this format so that you will write down something. And we have a quiz at the end of the class. So today we had a quiz in the general group, and these topics comes out very well in council. So don't joke with it. So we are using these video lectures so that it will be shorter. When we do the one we do on Telegram, it takes 2 hours, 3 hours. So that is why we are making use of this format, and after which the note will be sent to you. I believe you all can hear me. Welcome to Brainy Academy. So today we'll discuss quickly on an important topic, therapeutic diets. Now, I want us to write a diet refers to the type and the quantity of food a person consumes daily. While a therapeutic diet is a modified diet prescribed by healthcare professionals to manage, treat, or prevent disease conditions. Now, what you eat every day is diet. Your swallow, your rice, your wheat, your barley, your everything you eat every day is a diet. But whenever you hear the word therapeutic diet, now some years ago, you are your gender is just you are either male or female, but your enrollment into nursing school has made you a nurse. Now, diet is every what someone eats every day. But whenever you hear the word therapeutic diet, it is now the modified aspect of diet. Are we together? I come again. Diet refers to what you eat every day. But whenever you hear the word therapeutic diet, it is now the modified aspect of diet that is used to treat a patient. So now, what are the purpose of diet, therapeutic diet? Number one, to reduce stress on the affected organ. Number two, to correct nutritional deficiencies or excesses. Number three, to promote healing and recovery. Number four, to maintain optimal body function. Number five, to prevent complication. Now, looking at this purpose of therapeutic diet, we can understand that it is therapeutic because it is modified. The patient that is receiving it because of one ailment or the other. That makes it therapeutic. Just as I explained now, few years ago, your gender is either male or female, but you enrolling in this profession as a nurse, you become a nurse or a midwife. So a diet is just your normal food. But when we talk about therapeutic diet, it becomes the modified aspect of diet. The modified aspect of diet used to heal, used to treat a patient, or used to prevent disease condition. Now, this comes out very well in exams. That is why we are treating it tonight. So you need to pay close attention. You must see it in your exams. Now, there is a key principle of this therapeutic diet, I believe we are writing, and which is, if something is in excess, if it is excess in the body, reduce it. If it is deficient, increase it. So that makes it modified diet. If it is in excess, reduce it. If it is deficient, increase it. Types of therapeutic diets. Number one, many of you in the yesterday's quiz, many students failed this number one. So we have the gluten-free diet. Now, there is a disease called celiac disease. It's an autoimmune disorder where the body just stands up and begin to fight a protein called gluten. And this can lead to profuse diarrhea, weight loss, can lead to damage to the intestinal lining. So whenever the person eats things like bread, wheat, which contains this protein, gluten, the immune system starts reacting, and the intestinal lining will start getting destroyed. So for a patient having this celiac disease, an autoimmune disorder, we are going to give the person what? Gluten-free diet. So how will this come out in your exam? They will ask questions like this: a patient suffering from celiac disease will be given what diet? I want you to write the answer on the comment section. Let me know if people are following. I come again. A patient giving a patient having celiac disease will be given what type of diet? So the answer is what? Gluten. I'm happy. I'm impressed. Dara, I'm impressed. I saw your comment. I'm impressed. It shows you're following. So that patient will be given gluten-free diet because of what? Celiac disease. So examples of food the person can be given rice, maize, millet. Please, can we hear me? Can we hear me? High protein diet are diets. Remember, protein are high protein diet are diets. Remember, protein are bodybuilding food. So protein are bodybuilding food. So you give what? High protein diet when there are cases like burns, when the person is recovering from surgery. We give what? High protein diet, because protein is a bodybuilding food. So when there is damage in the body, what you will give is what? High protein diet to rebuild damaged body tissues. Protein helps in wound healing. Remember the word which we know very well: protein is a bodybuilding food. So when you give high protein diet, it will help in the bodybuilding of that patient. It will help to repair damaged body tissues. Examples: we have eggs, we have fish, we have meat, which we know very well. But a patient having CKD, kidney disease, you give low protein diet. But a patient recovering from surgery, we give high protein diet. So next is the fluid diet. Please notify me if you people are following me. Notify me, please. Let me know. So next on the list is the fluid diet. So these are diets consisting of fluids only. So there are two types of fluid. We have the clear fluid and the full fluid. So we give it in cases from the word fluid is in a fluid-like nature. So we give it before or after surgery. When the person is having difficulty swallowing, that is when we give what? Fluid diet, either clear fluid or full fluid. I'm receiving information that the network is bad. Let's continue. The video will be sent across. Now, next is the soft diet. From the word soft diet, these are diets that are made soft. You get a yam and you pound it. These are what diet. Maybe person is having dental problems. We give soft diet. They are easy to chew. They are easy to digest. That is why it is called soft diet. A post-operative recovery patient, we give what? Soft diet. So from the word soft, it is easy to chew. It is easy to digest. That makes it a what? A soft diet. So next on the list is what? Low fat diet. Now, very important that you note, we don't give high fat diet to what? Heart disease, because it can cause atherosclerosis. It can block the blood vessels in the heart. So, and also, whenever fat is being consumed, the liver and the gallbladder begin to secrete cholesterol. So when someone is having liver disease, gallbladder disease, heart disease, we don't give high fat diet. We give what? Low fat diet. What is low fat diet? Diets that have reduced fat content within it. That is what? Low fat diet. Which cases do we not give it? Liver disease, gallbladder disease, heart disease. Heart disease, because it will cause an accumulation in the heart, thereby blocking blood vessels. And any blood vessels that is blocked in any region of the body will definitely cause an indirect effect, negative effect on the heart. So low fat diets are diets that have low fat. There are no fats or very low fat in it. Are we together? So next is the word low salt diet. From the word low salt, we are restricting sodium because of diseases like hypertension. Because of diseases like hypertension, so we are restricting sodium. So a patient suffering from hypertension, you won't give the person a food or a diet containing salt. And by so doing, you are giving the person a therapeutic diet, because you are trying to prevent hypertension. Next is high calorie diet. Now, this is where question comes out also from. These are diets that provide more calories than normal. So where we give calorie diet, okay, someone is asking a question. I will come to that. Now, where we give calorie diet, high calorie diet, is in a patient that is what? Underweight. Thank you, Dara, for answering the question. Thank you. God bless. Now, for high calorie diet, a slim person, a emaciated person, we give what? High calorie diet. Number one, for energy. Number two, because of the underweight. So we give what? High calorie diet. Number one, for energy. Number two, if the person is underweight, an underweight patient, we give what? High calorie diet. There is a slight difference between, this is where question comes out from. There is a slight difference between calorie diet and carbohydrate diet, high carb diet. So the difference, both of them does the same kind of work. They give energy, but calorie diet helps to what? Stop underweight. It can increase weight. That is what? High calorie diet. Are we together? So now, calorie diet, whenever you hear calorie diet, remember Nurse Brainy says it is, remember, weight. Weight. So underweight, we give high calorie diet in order to increase the person's weight. Then if the person is overweight, obese, we give low calorie diet. Please, are we following me? Notify me in the comment section. I need to know. Are we following me? Please notify me. I believe the network is stable now. Notify me. Are we following? All right. God bless. Now, high carbohydrate diet. This, from the word carbohydrate, it deals with glucose. The main purpose why we are giving it is to increase energy. That is high carbohydrate diet. But we will give low carbohydrate diet for a diabetic patient because there is excess glucose in carbohydrate. Now that is why I said we should note calorie diet, the difference between calorie diet and carbohydrate diet. Calorie diet deals with weight. Now, Nurse Brainy shortcut, I want you all to write it. Carolina, let's find a female name. Carolina is underweight. What are we going to give to the patient? We're going to give what? Underweight, we give high calorie diet. Now, Caroline is overweight or obese. We give what? Low calorie diet. But for a diabetic patient, we give low carbohydrate diet because of carbohydrate deals with glucose. Whenever you hear carbohydrate, we do what? It deals with what? Glucose. Carbohydrate deals with what? Glucose. So for a diabetic patient, we give low carbohydrate diet. For a patient lacking energy, we give high carbohydrate diet. Now I've explained this number 10, low calorie diet. For obesity, for overweight, we give low calorie diet. Now that is what confused a lot of students. Now this comes out very well in exam. This is the part of the nutrition that comes out very well in exam. I will send this note across after the lecture. Now the next, okay, I've explained low carbohydrate diet for type 2 diabetes. Diabetic diet, also the same thing, we don't give sugar. Now, another one is low residue diet. Many students find it difficult to understand the low residue diet and the calorie diet. That is where students are being confused. Now, listen about the low residue diet. Now, low residue diets are diets low in fiber and indigestible materials. A diet low in fiber and remember, fiber leads towards diarrhea. Are we together? Fiber leads towards diarrhea. So low fiber diet will stop. It is given when a patient is having diarrhea. You give what? Low fiber diet, so that the person will not, the diarrhea will stop. Now, I love this question that I'm seeing. Which kind of diet is given to someone with an irritable bowel syndrome, sir? We are coming to that. Let us follow. I'm impressed. We'll come to that. Now, low residue diet, from the word residue, to remain, to be reserved. So, low residue diet, for someone having diarrhea, you will give low residue diet, because another name for low residue is low fiber diet, and fiber leads towards diarrhea. Fiber leads towards diarrhea. if you get if someone eats enough vegetable, the person will start having diarrhea, because all these things are fibers and they lead to what? They increase bowel movement. So we give what? Low fiber diet, or another name for low fiber diet is low residue diet. Now, for someone having constipation, please, I want you all to answer. For someone, a patient having constipation, what kind of diet are we going to give to the person? No. Someone answered fluid. No. What kind of diet are we going to give to someone having constipation, inability to ease themselves using the toilet? What kind of diet are we going to give to a patient having constipation? If we give low residue diet, low fiber diet to someone having diarrhea, I'm impressed. High fiber diet or high residue diet. Yes, you are correct. So we give high fiber diet to someone having constipation so that the person will be eased. So those fibers will go and melt those constipated fecal impaction, thereby leading towards the constipation being removed. Are we together? So we give what? High fiber diet to a patient having constipation and low fiber diet to someone having diarrhea. When you see, as a nurse or a midwife, you see a patient, a small child, he has been using the toilet for more than 3 times, which is the definition of diarrhea, watery stool more than 3 times. You can't give the person what? You can't give the person what? Fiber diet. So you give low fiber diet so that the person, you will not increase the diarrhea. I believe this has been explained. Let's move to the next one. So high fiber diet for person having what? Constipation. Now, what is the full meaning of DASH diet? You are writing your counsel very soon. What is the full meaning of DASH diet? I'll be waiting for the answer. DASH diet. Let's know those that know it. Now, DASH, I won't tell you yet. I want you all to write it so that next time you won't forget it. Now, DASH diet is given for hypertension. DASH diets are given for what? Hypertension. So there are foods that can worsen it, salt, junk food. So you avoid all these. These are DASH diets. You avoid all these food that can lead to what? Hypertension. So DASH diets are food diets that are used to stop hypertension. I come again, write it down. DASH diets are diets that are used to stop hypertension or to prevent hypertension or to manage hypertension. DASH diets are diets used to stop, manage, or prevent hypertension. I'm impressed. Someone just said the correct answer. I don't know who the person might be, but I think it's from Iyenu. Dietary approach to stop hypertension. That is the full meaning of DASH diet. DASH diets are given to stop what? Hypertension. Next is the bland diet. Many students get confused. Which one is bland diet? Now, the bland diets are diets that are soft. Number one, as we can see, number one, they are soft. Number two, they are non-spicy. And number three, note my words. Bland diet, from the word bland, it is bland. They are soft, they are non-spicy, and they do not, this is the most vital point, they do not irritate the stomach. Bland diets do not lead to what? Irritation, because someone asked a question before. So now, for someone having peptic ulcer, what kind of diet are we going to give to the person? We'll give what? DASH diet. We give bland diet. For someone having hypertension, we give DASH diet. For someone having peptic ulcer, gastritis, anything that can cause irritation, we give what? Bland diet. So in your note, I want you to write it. Bland diet is for what is like it goes pari passu with irritability. Anything that can cause irritation, we give what? Bland diet. Bland diet. So examples of food that are bland, food that does not have spicy pepper in it, are examples of what? Bland diet. Next on the list is, okay, so summary: disease, problem in the body, diet, and the reason. So CKD will give what? CKD leads to what? Waste buildup. So we give low protein in order to reduce urea. In hypertension, leads to what? Fluid overload. We give low salt in order to reduce BP. For diabetes, it can lead to high blood sugar. So we give low carb diet or diabetic diet in order to what? Control glucose. For constipation, leading to heart stool, we give high fiber diet in order to what? Ease this constipation. For diarrhea, we give low residue diet. For burns, we give high protein diet. Now, question. I want you to, well, you are going to send me the answers. You're going to send the answers to me in WhatsApp now. Now, question number 1. A patient with peptic ulcer is admitted with epigastric pain. I come again. A patient with peptic ulcer is admitted with epigastric pain. Which diet should the nurse expect the doctor to prescribe? A, we have high fat diet. B, we have bland diet. C, we have high protein diet. And D, we have low sodium diet. Let's see those that are quick and fast that will give me the answer in the comment section. So you also note them down, write them down. You send it to me in WhatsApp, but if you want, you can write it in the comment section. So a patient with peptic ulcer is admitted with epigastric pain. Which diet should the nurse expect the doctor to prescribe? A, fat diet. B, bland diet. C, high protein diet. And D, low sodium diet. Number 2, a patient with, please, are we together? Can you all hear me? Can we hear me? All right. A patient with CKD. I'm impressed. I'm impressed to the student that got this now. I'm impressed. Yes, I'm impressed. You are following. A patient with CKD, chronic kidney disease, has elevated urea levels. Which diet is most appropriate? A, high protein diet. I come again. A patient with CKD, chronic kidney disease, has elevated urea level. Which diet is most appropriate? A, high protein diet. B, low protein diet. C, high carbohydrate diet. And D, high fat diet. A, high protein diet. B, low protein diet. C, high carbohydrate diet. And D, high fat diet. I'm impressed. Many students are getting it, and I'm so impressed. With this class, and by God's grace, once you see this in exam, you are definitely passing it. I'm impressed with the answers I'm seeing. Now, number 3, I want to still see it on our WhatsApp group. Number 3. Yes, I'm impressed. Number 3, a postoperative patient is unable to tolerate solid food. Which diet should the nurse administer first? A post-operative patient is unable to tolerate solid food. Which diet should the nurse administer first? A, full fluid diet. B, low salt diet. C, high fiber diet. D, high protein diet. Oh, I'm impressed. Those that are getting it, I'm impressed. I'm filled with joy. Yes, I'm impressed. I will not say the answer in this live class. I want you all to say, I want us to do correction. So make sure you are writing it down. Yes, I'm impressed with those. Just that I'm impressed. I'm impressed. Now, number 4. A patient with constipation is placed on dietary management. A patient with constipation is placed on dietary management. Which diet is most appropriate? A. Low residue diet. B. High fiber diet. C. Bland diet. D. Low protein diet. I come again. A patient with constipation is placed on dietary management. Which diet is most appropriate? Constipation. So A, low residue diet. B, high fiber diet. C, bland diet. D, low protein diet. Yes, I'm impressed. You all are getting it and I'm impressed. So number 5, a patient with diarrhea is advised to rest the bowel. Which diet is expected? A patient with diarrhea is advised to rest the bowel. Which diet is expected? A. High fiber diet. B. Low residue diet. C. High protein diet. And D. High fat diet. Now, this is how these questions come. They come confusing. You see, when you are saying diet, 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 they come confusing. Without proper knowledge, you will make a mistake. So you need, number 1, to read the question very well. Number 2, very important, listen to me. Number 2, you find the case, the medical case that is being mentioned. That is how you will know the correct diet that you are going to give. So a patient with diarrhea is advised to rest the bowel. Which diet is expected? A. High fiber diet. B. Low residue diet. C. High protein diet. Oh, I'm impressed. Those that are getting this, I'm so happy. I'm so happy. God bless you. I'm so happy. It shows that you learned what is being taught. Number 6, a patient, a patient with gout is advised dietary modification. Which food should be avoided? Now, I did not teach this one, but I set it as a question because it comes out very well. Let's note those that we make an attempt to this question. A, vegetables. B, fruits. C, liver. And D, rice. So a patient with gout should avoid what? A, vegetables. B, fruits. C, liver. And D, rice. Let's know your answers. A patient with gout is advised dietary modification. So which food should be avoided? A, vegetables. B, fruits. C, liver. And D, rice. Yes, I'm impressed. Those that are getting it, I'm impressed. This question comes out very well in exam. This question comes out very well in exams. Now, next question. A patient with heart disease is advised to reduce fat intake. Which diet is appropriate? I come again. A patient with heart disease is advised to reduce fat intake. Which diet is appropriate? Heart disease is advised to reduce fat intake. Which diet is appropriate? A. Low fat diet. B. High protein diet. C. High carbohydrate diet. And D. High sodium diet. So someone with heart condition is advised to take A. Low fat diet. B. High protein diet. C. High carbohydrate diet. And D. High sodium diet. Which is the correct answer? I want you to think